Hey Aya, welcome to my first official video. This video will be about transgender. Before I start, I do want to mention that there will be mentions of reproductive organs, prostate cancer, idiopathic short stature and endometriosis, gender dysphoria, mental health, self-harm. Usually I won't go into detail. If you don't want to hear about these topics right now, I completely understand. Put your mental health first. Now let's get into it. Doctors recommend thinking about these things before you do any surgeries, take any medicine. If you have no dysphoria with some parts of your body, then don't have a surgery. Hormone therapy is highly recommended before planning any surgeries. Psychotherapy can help to deal with negative thoughts that might occur because of gender dysphoria. It's better that you get evaluated by a qualified mental health professional before starting any medications and doing a gender surgery. The final result can take some time since they want it the safest way possible and the least complications. That being said, here is a lot of info about puberty blockers, or also known as GnRH analog. Puberty blockers might affect primary sexual organs such as penis, scrotum and testicles, and the uterus, ovaries and vagina. Secondary breast development and facial hair. Male at birth decrease growth facial hair and body hair, prevent voice deepening, limit growth genitalia. Female at birth limits or stops breast development and menstruation cycle. The pros are: improves mental health, reduces anxiety and depression, improves social interactions with other people, eliminate the need for future surgeries, reduces thoughts or actions of self-harm. However, if you want to start this treatment, you need to show a long-lasting and intense pattern of gender nonconformity or gender dysphoria, have gender dysphoria that began or worsened at the start of puberty, address any psychological, medical, or social problems that could interfere with treatment, have entered the early stage of puberty, provide informed consent, if the person is under the age of medical consent, 16 years, parents or guardians must give permission. These puberty blockers only pause puberty. When the teen decides to quit the treatment, puberty will resume. Because of the blockers, the teen and doctors have more time to figure out if the gender dysphoria is long-lasting or not. It also gives children and their families time to think about or plan for the psychological, medical, developmental, social, and legal issues ahead. Since that I'm trying to educate, I do have to give some info that's considered more negative. Long-term effects are growth spurts, bone growth and density, future fertility. Depending on when pubertal blockers are started, there is an option to follow counseling for the child and guardians through the decision-making process and support during therapy. Many people think that GnRH analogs are only being used for trans teens. This isn't the case. It's also used for kids with idiopathic short stature and adults with endometriosis and prostate cancer. Here is in short what these conditions are. Idiopathic short stature, or ISS, is a condition where the height of an individual is a lot lower than the average height. Sorted in groups, sex, age, and population. Endometriosis can cause pain, sometimes severe, especially during menstrual periods. Fertility problems also may develop. Prostate cancer is the most common cancer among men. GnRH analog include goserelin, Zolacard registered, hystrelin, suprelin registered, La, luprolide, Lupron depot, PED registered, triptorelin, Trolstar registered, is said a few times gender dysphoria, but what is it? Gender dysphoria is when a person experiences psychological distress because the sex that they were assigned at birth doesn't line up with how they feel inside. However, gender dysphoria is not always the result of one's gender identity not lining up with how their body is changing. It can also stem from the stress of dealing with societal norms, as well as the possibility of being rejected or bullied. It's also important to note that not every transgender or non-binary person experiences gender dysphoria. How do you take the puberty blockers? Puberty blockers are administered by a healthcare provider through injections or an implant that goes under the skin. In order for puberty blockers to keep working, injections must be received monthly or every few months, and implants have to be replaced yearly. Puberty blockers can be instrumental in preserving the mental health of young people who are establishing their gender identity. One study showed that transgender teens who were able to receive puberty blockers experienced superior mental health outcomes when compared with those who wanted the medication but did not receive it. This goes to show that puberty blockers play a significant role in gender-affirming care. Once a child goes off of a puberty blocker, the bone mineral density increases, but it does not get back to where it was before. To help maintain healthy bones, we keep a close eye on vitamin D levels and make sure that kids are getting enough calcium. If a child with male genitalia starts puberty blockers early in puberty and later wants to have gender-affirming surgery, they may not develop enough skin on their penis and or scrotum for the most common genital surgical procedures. However, if this occurs, other options are available and they should be discussed with a surgeon after the age of 18. Here are a few more short-term side effects: crying and irritability, restlessness, injection site reactions or pain near the site, acne, rashes, headaches, weight gain. Now that science part is over, I want to share as well that when the LGBTQ+ community gets support of their loved ones, their mental health is a lot better. Thank you so much for watching. I hope you learned more. See ya in another video.